Those of you who are planning on starting Medicare soon, yet you've decided to delay your Social Security benefits, you're actually going to be receiving a bill ranging anywhere from $370 to $925. Now, that bill is going to be due on the 25th of the month prior to you starting Medicare. So in this video, I'm going to explain why you could get such a large bill and what you can do about it. Now, to address this issue of potentially getting a large bill from Medicare for your first bill, what I'm going to do is look at the original Medicare system, Parts A and B, and we're going to talk about what those cost and how you pay for those. All right. So let's begin by talking about Part A. First off, what does it cover? Well, Part A will include coverage for your inpatient hospital stays. You're not under observation. You've actually been admitted to the hospital. A is going to pay the bills. A also pays the bills for what we refer to as inpatient rehab. This is someone that maybe had a stroke or possibly an injury, accident, a fall, or maybe hip replacement, and they're going to skilled nursing for the rehab. Part A will also cover hospice benefits. So the hospice is when someone has been diagnosed with a terminal illness, in the doctor's opinion, 6 months or less to live, and now they're under hospice care, so A of Medicare will pay those bills as well. So these are the primary things covered by Medicare Part A. Now, secondly, I want to look at what Part A is going to cost on a monthly basis. Okay, this would be monthly. And now we're talking about premiums. So what does it cost to be enrolled in Part A? Well, for the majority of you, it's going to be zero, okay? Zero. Why is that? Well, though it's a zero premium, the reason they do that is because you and I pay into Medicare Part A our whole life. So if you're working and you're paying into the Medicare system through FICA taxes or self-employment taxes, as long as you accumulate a total of 40 quarters, which is equal to 10 years worth of employment, then you get Medicare Part A at premium free. Again, why you prepaid it. All right, and so 10 years worth of work. And so what happens is if someone doesn't have 40 quarters, the first thing we do is we look to a spouse that is at least 62, that has 40 quarters, and you've been married for at least a year, you can draw from a spouse. Or if someone's not married, they actually can get benefits from an ex-spouse. The way that works is you had to be married for at least 10 years or longer. We proved this with a divorce decree. There could not have been a remarriage prior to the age of 60, and so you can draw from an ex-spouse and get your benefits because of their 40 quarters. Okay, so these are the two ways we can do it if we don't have our own 40 quarters. But again, most people have their own, and in fact, they say 99% of all people are going to get Medicare A premium free. So if someone doesn't have the 40 quarters, what happens? They have to now buy it. And so the way it works is this: if someone has between 30 to 39 quarters, not quite to 40, but they're close, they are paying this year $285 a month for their Medicare Part A. If they're down there and they have 0 to 29 quarters, it costs them $518 a month. And of course, if they have this, it means that they're not receiving Social Security benefits, so they're actually having to pay this in the form of a direct bill. Now, what sometimes will happen, people are close. Maybe they're 36 or 37 quarters. So if they can, we encourage them to go back to work, because a quarter is not 3 months. A quarter is this year $1,810 of W-2 income or net self-employment income. That will give us 1 quarter. All right, so let's say I have 36 quarters and I can't get it from a spouse or ex-spouse. Then if you make this year, that'd be 0 and 4, 72. If you make $7,240 in W-2 income or net self-employment income, you just picked up your 4 quarters for this year. And so again, if people are close, we encourage them, they can't go back to work, because we move out of the column of paying for it up to the column where it's going to be 0 premium for the rest of their life. All right, so number 3, issue here is how to pay for Part A. Well, clearly, if you don't have your 40 quarters, they're going to bill you for this on a monthly basis. But if you are at 0, there is no bill whatsoever. So it is paid through a direct bill or 0, of course, because you've already prepaid that. Now let's talk about number 4. What are the other out-of-pocket costs associated with Medicare Part A? And it's very simple. There's basically 3 of them. The first one would be if I'm using Part A, that means I'm admitted to the hospital, and what Part A has is a Part A deductible. And that deductible this year is $1,676. Okay, so that means when I go to the hospital, that's what it's going to cost me. So again, we're talking about other out-of-pocket costs associated with this. And so this is what I would pay from anywhere between a 1 to 60 day stay in the hospital. I pay the deductible. Now, what's interesting about this deductible is it's not annual. This is tied to a benefit period. So this deductible can happen more than once in a year. So when I'm admitted to the hospital, I begin a benefit period. And let's say I'm discharged 7 days later. They discharge me. Now for the next 60 days of discharge, I am still in my benefit period, which means if I'm re-hospitalized during that 60-day window, I go back to the hospital, I'm still covered by the same deductible because I'm in the same benefit period. But if I'm hospitalized, 7 days later I go home, 60 days goes by, nothing happens to me that would require hospitalization, but happens after that, and I go back to the hospital, then I would pay this deductible a second time during the same year. All right, so you see the point. That is an out-of-pocket expense you're responsible for. Now, number two would be what we call copays for extended hospital stays, copays. And so what happens, this is the first 2 months, then the next month, month 3, I would have a $519 a day copay for any days between 61 and 90. Okay, third month. And then after that, if I'm still in the hospital, it doubles to $838 a day to the hospital, and this should be for days 91 to 150. So that's month 4 and month 5. And again, these don't happen often, but this would be an out-of-pocket expense if I had that additional days beyond the first 60 days. And then the last one would be for skilled nursing facility. Remember, I said Part A covers this. So how it works is this. The first 20 days in the skilled nursing facility doesn't cost me anything. There's no cost as long as I had a 3-day hospital stay. But after that, from days 21 to days 100, I have a daily copay now of $209.50 a day. So Medicare covers everything the first 20, as long as I was in the hospital at least 3 days or longer. And then after that, I have a responsibility of a daily copay. So what I'm trying to teach you as we look at our out-of-pocket expenses, we got a deductible, we have copays for extended hospital stays, and we also have copays for extended skilled nursing facilities. And so the question is then, number 5 here, how to pay for these other costs. And so what happens, the majority of people who look at this say, I don't want this kind of liability. And so what you can do, you can actually buy a Medicare supplemental plan. And the most common ones today are Plan F, Plan G, Plan N, but all those plans would do what? Would cover all these expenses. So you wouldn't have to be out of pocket whatsoever. Every one of those plans, F, G, and N, and a couple of the others would cover everything 100%. And so when you buy a supplemental plan, that's one of the beauties of them. They will cover these out-of-pocket expenses. Plus, if you're ever in the hospital longer than 5 months, pretty rare, but when it happens, every MedSup plan that is really popular today, the F, the G, and the N, would give you an additional 365 days in the hospital at no cost to you. Now, some people decide what they're going to do is they are going to get a Medicare Advantage plan. And with Medicare Advantage plan, what happens then to cover some of these costs, you actually would have to pay a daily copay, maybe $300 or $400 a day to the hospital for maybe 5, 6, or 7 days. All right. So the point is there are ways that where you can look at these expenses and you either pay them out of pocket yourself or you can transfer that risk to an insurance company. All right. Then the last issue I want to address is when to take Part A. And so when it comes to Medicare, the majority of people are coming in and they're eligible for Medicare at 65 as long as we have 40 quarters. All right, so when to take Part A at 65? Well, if you or your spouse are no longer working, meaning you don't have an employer plan available to you any longer, well, then you're going to enroll into Medicare Part A for sure. Now, if you are still working and you are going to continue to work, you're covered by a good group plan, and you're not contributing to an HSA, and then at 65, what I would do is then I would take A only. Now, keep in mind, if you're no longer working, your spouse isn't, you're going to enroll into A and B. But if you are still working, then you do not have to take Part B, and it's fine to take our A only as long as you're not contributing to an HSA. But if you're going to keep working and you are putting money into an HSA, these are called health savings account. Remember, the money goes in pre-tax, it grows tax deferred, and if you use it on qualifying medical expenses, it is tax exempt forever. And so the point is HSAs, they're kind of like a healthcare IRA. And so if you're contributing to that, then what you want to do is when it comes to A only, then I wouldn't do do that either. Don't do it. Just nothing. Don't do anything with A. Don't do anything with B. It's not necessary. All right. Because if I take A only, I can no longer put new money into my HSA. So if that's something you want to do, again, don't even take A only. All right. That brings us into item number 2, and that is what is Part B going to cover. And so the way to look at Part B is that pretty much everything that is going to be on the outpatient side of Medicare. Remember, A was inpatient, hospital skilled nursing. This is outpatient. So if I go in for labs or an MRI or a CAT scan or a PET scan, if I have an outpatient surgery like a knee replacement or a cataract surgery, those kind of things are going to be paid through Medicare Part B. And then also, very important to note this, all doctor services, all physicians, this could be primary care doctors, it could be specialists that you see, but it also includes all doctors that would take care of you in a hospital setting. So hospitalists or ER doctors or a surgeon or an anesthesiologist, they're going to be also paid through Medicare Part B. So A, paid the facility, but B, pays the doctors that take care of us in those inpatient type facilities. Also, we have here durable medical equipment. Right? So when someone has oxygen equipment or maybe a wheelchair or a scooter, a CPAP machine, nebulizers, those kinds of things are durable medical equipment and they're covered by Medicare Part B. Also, whenever people go into a rehab situation, but they don't have to have skilled nursing, but they need some care, it is the home health care. This would be after like a knee replacement. We have to go home for rehab. The home health care agency would be paid through Medicare Part B. So the whole point is these are the main services then covered by Part B. All right, that brings us then to the second point here about Part B, and that is what does it cost on a monthly basis? And again, we're talking about Part B premiums. All right, Part B premiums. Well, Part B premium, unlike A, which is zero for most people, B is going to have a cost for most people. Now, if someone qualifies for state Medicaid, then the state Medicaid could cover some of those Part B expenses. But the majority of you watching this are not on Medicaid, so you're actually going to have an expense for Part B. Now, I am shooting this video on September the 4th, 2025. I don't know when you're watching this, but if you happen to be watching this sometime in 2026, no doubt the Part B premium is going to be higher. But right now, that Part B premium for most people is going to be $185 a month. All right, and so what that equates to is every year Medicare calculates what it will cost them to cover the average Medicare recipient for Medicare Part B. And so what happens, this is actually 25% of what they estimated the cost would be. So as Medicare prepared for this year, 2025, as they made the projections, what they said was Medicare Part B average was going to cost the federal government $740 for Part B benefits. And so what happens is the majority of you are actually paying 25% of that cost, and then Medicare pays the other 75%. All right? And so the whole point is we are paying for Part B. Now, again, I don't know what the total will be for the following year, but right now that's what it is. Now, if you're on Social Security, that Part B premium of $185 is going to come right out of your Social Security check the month your Medicare begins. But if you're not taking Social Security, then what happens is they're going to bill you directly for that. And so here's the process. Because you're not on Social Security, you are not enrolled into Medicare automatically. Anyone on Social Security automatically enrolled in A and B. And Medicare card shows up about 100 days prior to your birth month. But when we're not on Social Security, then we have to self-enroll. And if we're going to start our Medicare initially at 65, we have 7 months to do that. 3 months before we turn 65, the month we turn 65, and 3 months after. We call that the initial enrollment period. And so when we self-enroll, we are now not only going to be self-enrolling, but now we're also going to be receiving a direct bill. Okay, a direct bill. And so this bill could be this. It could be as little as 2 months of premium. It could be 3, 4, up to 5 months of premium. So at the minimum, on a direct bill basis, what's going to happen is you're going to get a $370 bill. Why? That's 2 months. And at the high side, you're going to get a bill of 5 months, and that's going to be $925. It could be somewhere in between. So the first bill is almost somewhat kind of like a lottery. As people do enrollments throughout the day, they don't want, meaning the Medicare department doesn't want everyone coming due at the same time, so they rotate the cycle. So you do an enrollment, and your Medicare first bill could be 2 months, $370. Next person that enrolled, 3 months. Next person, 4 months. Next person, 5 months. And it just rotates through all day long, 2, 3, 4, 5. So we have no idea exactly which of these bills you're going to get. We just know that you're going to get one, all right? Somewhere between 2 to 5 months. Now let's go back and let's talk about the 185, because this is what about 90% of all people are paying this year. However, there are some people that are actually paying more for their Medicare Part B, and these are people that are deemed to be high income. And so what Medicare does is they actually set thresholds. And for the sake of this video, there's a couple different thresholds. I'm just going to talk about 2 of them. I want to talk about single filers, their thresholds, and couples that are married and they file a joint return. So the threshold this year, and again, we think it's going to change in 2026, but right now that threshold is $106,000, and this number is actually your modified adjusted gross income. Modified adjusted gross income, and this number comes from 2 years prior, so they're going to look at 2023 modified adjusted gross income. You can do the same. All you do is take line 11 on your tax return, that's AGI, adjusted gross income, and add line back in 2A. Now, most people don't have anything on 2A, but 2A is your tax exempt interest. So if you invest in municipal bonds or territorial bonds, Puerto Rico, Guam, those places, then you don't have to pay any federal income taxes on your interest from those bonds, but you have to report that. And when you report that, that is on line 2A. So they take line 11 plus line 2A equals your modified adjusted gross income. Again, they're going to look back at 2023 for this year. So they're looking at 106. So if someone stays below 106, they again pay that 185, 25% of what actually costs the government to cover you. A married couple would be doubled. So we have $212,000 or below. Each of you would pay 185. But what happens if I'm above the thresholds, above 106 or above 212, what happens now, we have additional charges called surcharges or IRMAs. It's an acronym, IRMA, I-R-M-A-A, income-related monthly adjustment amounts. And those would be added to your Medicare Part B as well as your Medicare drug plan. All right, and so what happens here is, again, we have these 5 different brackets. I'm not going to get into that, but there's 5. I look at them like marginal tax brackets. The more you make, the more you pay. So the more money you make, the more of an IRMA that you could have. And again, so for above the thresholds, we're going to pay more for our Medicare Part B. And so what happens is the very lowest IRMA, you're paying 35% instead of 25%. At the next IRMA, you're paying 50%. Next one, you pay 65%. Next one, 75%. And the highest IRMA, you're actually paying 85% of what it costs the government to charge you. So they're saying you make more money, and we're not going to offset as much of your Part B expenses as we would someone that is at the threshold or below. All right? Now, keep in mind, if someone retires, since they're looking back at 2023, and you may get an IRMA bill, but if you have a life-changing event, one of 8 events, then you can appeal those IRMAs and either reduce them or eliminate them. All right, and we help people, of course, with that all the time. So I want to make sure that you know what it's going to cost you on a monthly basis. So when we talk about these bills, it could be that, and it could even be more, indeed, if you're going to be charged an IRMA because you're above the thresholds. All right, that brings us then to how you can pay your Part B premiums. Okay, so let's put the number up one more time. Most people are going to be $185, and if you're on Social Security, that is going to come right out of your Social Security check. You have no option whatsoever. The month you start Medicare, they're going to take that out of your Social Security check. But if you're not, as I said, you're going to be billed directly. And so that's going to be anywhere from 2 to 5 months. We said this year that's $370 to $925. If you have an IRMA, it could be more. And so what happens is you are going to get a direct bill. The very first bill is going to be one of these. Okay, but then after that, they're going to bill you then on a quarterly basis. So you'll get a 3-month bill thereafter. So in this example, it'll be 185 times 3. First one, 2 to 5 months. Thereafter, every quarter. All right, now, sometimes people don't want to have to get a direct bill. Number one, they may not like the amount of that, but they just don't want the responsibility of that. They don't want to miss paying a bill. And so what you can do, and I recommend this all the time, is this. You can enroll into a program that is called Medicare Easy Pay. And basically all this is a bank draft, an EFT, ACH from your bank account, checking or savings. And you have to fill a form out. It can be done online. It's very simple to do. You give them a routing number, the name of the bank, and your account number. And then instead of you getting a direct bill, then they'll start drafting this out of your checking account, savings account. And they typically do the drafts on the 20th day of the month. And so again, if you're up here at 185, so you don't have to pay these larger bills, they'll draft 185 out of your checking savings account on the 20th of the month that your coverage begins. All right? And so I'd said earlier, this bill comes to you on the 25th day of the month prior to starting coverage. So let's say someone in this example is starting Medicare in October this year, October 1. Their Medicare bill, again, their first one, 2, 3, 4, 5 months, will be due September 25th, here in just, a couple weeks. It'd be due. So it's always due, the first bill's due the 25th of the month prior to when you start your Medicare. And then after that, it's going to be, of course, on a quarterly basis. All right. So that's how to pay for it. Either Social Security, do Easy Pay, or a direct bill. All right. So just as we talked about other out-of-pocket expenses on A, let's talk about those on the B side so you were clear on how this system is going to work. Remember how I said Part A had 3 gaps, a deductible, co-pays for extended hospital and skilled nursing stays. Now on the B side, what we also have a deductible on Part B. And this year, that Part B deductible is $257. Now, I would suspect it's going to go up in 2026, but that's what it is right now. Now, the difference of this deductible versus A is this is a calendar year deductible. It is not going to occur more than once in a year, but it's tied to the calendar. And so it's not prorated. So if you start your Medicare in January, it's $257 deductible. If you start in July, $257 deductible. You start in December, $257 deductible. They do not prorate that. You pay it once a year, and then every January, that Part B deductible is going to reset, and then you'd be responsible for that. So that is gap number one. Gap number two is Medicare on the B side of Medicare, doctor services, outpatient, all that stuff. Medicare pays 80% of the bill. You pay 20% of the bill. We call that co-insurance. Okay, and so that's your second gap. We've met our deductible. We have then after that, as long as you're seeing a Medicare provider getting a service that's covered by Medicare, then Medicare is going to pay 20% of the bill. You're responsible for 20% of the bill. And then the last gap, frankly, happens rarely, but it does happen. And this is called excess charges, and this is when a doctor can see you as a Medicare patient, but they're not under a contract that obligates them to take the Medicare reimbursement rates as payment in full. Okay, they're under a different contract, and so they actually can legally add 15% to the bill. Now, it rarely happens, definitely less than 5% of the time, probably more like 3 to 5%, but again, it's just a rare occurrence. But on that occurrence where it would happen, then that 15% would be your financial responsibility, and so if you see a doctor that adds it, you got to pay it. So the point is, those are our 3 gaps: the deductible, 20% coinsurance, the possibility of excess charges. All right, and so the question next is, how are we going to pay for these other costs that we're responsible for? And again, a lot of people don't like these particular gaps, so what you can do, you can buy a supplemental plan. Now remember, anytime someone talks about supplemental plans, we also refer to those as Medigap policies. Okay, Medigap policies, filling in the gaps. And again, the top plans today are F, G, and N. And so what happens, they're different letters, so different coverages. The F plan actually covers all 6 of the gaps. 3 on the A, 3 on the B. Now, the problem with the app plan today is that the majority of you watching this probably couldn't qualify for it because you had to start Medicare before 1/1 of 2020 to be able to get the F plan. And if you did, then you could still get an F plan. They're not a very good value in my opinion today, but you're still eligible as long as you started Medicare before 1/1/2020. But anyone starting Medicare after 1/1/2020, what happens? You can get the G or the N. Now, here's the way it works. The G plan covers 5 of the 6 Medicare gaps. The N plan covers 4 of the 6 Medicare gaps. So the G is close to the F in that it's full coverage other than you have 1 gap, and that's the annual Part B deductible. Remember this year, $257. You'd have to pay whatever the B deductible is. After that, 100% coverage. All right. Now the in plan for the 6. So the 2 that it will not cover would be your Part B deductible, just like the G, $257 this year, and then it will not cover excess if and when that occurs. Again, it's rare, but again, if you're on an in plan and you happen to go to a physician or a surgeon that charges excess, you'd have to pay that out of your pocket. Plus, the in also has a couple of copays. Okay, they're very reasonable copays. Copays to the doctor, $20, specialist, $20. Those, kind of physician services, $20 copay. You go to the emergency room, you have a $50 copay. Again, very reasonable. And so the question is, well, why would someone get a G and why would someone get an N? Well, in most markets today, most, not all, but most markets today, we're going to see about a $40 to $50 a month difference between G and N. So if you're in a state where it's $50 less, you save $600 on the in plan. You're responsible for a couple copays, excess if and when that occurs. And so some people would just soon pocket that $600 and save that and kind of take on just a little bit of additional risk. Others say, now I want the most comprehensive plan I can get. The $50 is not going to make or break me, and they'll get a G plan. There is no right or wrong. They're both wonderful, wonderful options. So the whole issue is, how are we going to get these other out-of-pocket costs covered? You don't want to be responsible, especially for that one. And so what happens? If I had an F, covers them all. If I had a G, it's going to cover the 20% coinsurance and excess. If I have an N, it'll cover the 20%, but you would be responsible for the excess. So you see the point. So most people that look at this system that want to stay in original A and B will transfer that risk to an insurance company and pay them a premium, and hence they'll get issued a supplemental plan. All right, that brings us into our last slide, and that is the issue of when to take Part B. Again, let's talk about it. At 65, who should do this? Well, if you or your spouse are no longer working and you don't have an employer option available to you, then you have to enroll in a Medicare A and B. The same would apply if you're on COBRA insurance. You got to enroll into A and B at 65. If you're retired military, have TRICARE. A and B at 65. If you work for a small employer plan, 19 or fewer employees on the payroll, again, A and B, because A and B has to be in the first payer position, your group plan will then only pay second. If you're covered by an ACA plan, an Affordable Care Act plan, you went through the healthcare exchange to get insurance. At 65, all the financial incentives are gone. You don't get a reduced premium, tax credits, cost sharing, all those are gone, so you're going to get off of an ACA plan at 65. And so all I'm trying to teach you is that some of you are going to start at 65. Others of you, you're going to go into Medicare B after 65. Right? Well, why is that? Because you or your spouse are working and you have a very attractive, competitive group plan. You like the coverage, you like the cost. Maybe your spouse is younger and on the plan, or your children on the plan that are younger, covered at age 26. So as long as you or your spouse still working, you don't have to take Medicare A or B. We've already talked about that. Remember, I said I would take A only as long as I don't have an HSA. And in this situation, what I'm saying is that you're not required to take B after 65. You will not be penalized as long as you keep working. So just make sure if you don't take a 65, we just have to have some group insurance, employer active coverage, not COBRA for sure, but active employment coverage by you or your spouse, and you'll have no problem coming into Medicare B at a later date, and you will do that with what we call the SEP, or the Special Enrollment Period. At 65, we call this IEP. SEP is different in that you didn't take it 65 because you or your spouse kept working, and now we're 67, and now we can come in using the special enrollment period. We just have to prove credible coverage by your employer, and then you pick the date you want to start. It's really a very seamless situation there. All right, so that's when you want to take Part B. Now, one quick caution, I'm going to close this out. Those of you that are on Social Security right now, what's going to happen is you're going to be auto-enrolled into Medicare A and B at 65. And I'm telling you, that Medicare card is going to show up. So if you have Social Security, you will be auto-enrolled. And so the card shows up about 100 days prior to your birth month. And what happens when the card shows up and you have a good group plan, you like the cost of coverage, it's yours or your spouse's, doesn't matter, but you want to stay on that group plan, what I would recommend doing is I would recommend canceling Part B and just have A only. Now, if you have a lousy group plan or an expensive group plan, keep A and B and get off the group plan. But if you have an attractive group plan, what I would do is disenroll from Part B. And you can do that by mailing your card back in. You got to sign it on the back saying I don't want Part B, or you can fill out a form called a 1763, and then they'll send you back a new new card that says Medicare A only, and then again we can pick up B at a later date using the special enrollment period. And why I'm saying this is because if your group plan has 20 or more employees in it, what happens, the group plan pays first, and Medicare A and B is going to pay second. And so you just paid at least $185 a month for Part B to be in the second payer position. And if you have a good group plan, to me, that's really a waste of money. So send the card back in, pick up B at a later date. All right, so if you're not on Social Security, you know you're going to have to initiate the enrollment, and when you do so, you're also going to be under a direct bill basis. So Part A, for most of you, 0 premium. Part B, going to get that first bill anywhere from 2 to 5 months, and then if you have an IRMA, you're going to have an additional bill beyond that. All right, so that's why I'd encourage you, if you don't want to pay that large bill, then go ahead and enroll into the Medicare Easy plan. It's very simple to do the enrollment, and it makes things much simpler for you as well.